One of the reasons that wound care is so important is it's going to be the most effective thing to prevent infection. We will be making sure that everything is completely sterile prior to procedures, whether it be excisions or a Mohs surgery, but it's really important for you at home to make sure that you are taking really good care of your wound to prevent those infections. By keeping it covered, using the Vaseline, and avoiding things like chlorinated pools or hot tubs within 2 weeks of your procedure is going to be really important to keep that wound bed really nice and healed, or help it heal most optimally. It is something where the signs of wounds infection can be redness surrounding the wound, if it gets tender or painful to the touch, if you start noticing there's drainage or pus coming out of the wound. Those are all things that can be indicative of wound infection, and would be important to give us a call and let us know that you may be dealing with that. We are always happy to accommodate and get you in for a quick wound check if it's something you're particularly concerned about. And certain areas of the body, like I had mentioned before, your lower legs, backs, arms can be a little bit slower to heal. So just because it's a little bit red or kind of looks slightly irritated does not mean the wound is infected, but really gauging that tenderness, drainage, swelling as all signs of wound infection. Oftentimes we like to see our patients back within about 2 weeks after a procedure, whether it's that excision, Mohs procedure, or even that electrodesiccation and curettage, or ED&C. And that allows us to check and make sure things are healing optimally. We are always happy to see you sooner if you have any concerns. I hope this was helpful for you. Again, wound care is so important and such a common part of our practice to give you the most optimal results to not only prevent infection, but cosmetically make sure any type of scarring is minimal at most. Thanks so much.